TARGIT-E stands for elderly patients. So here we designed a targeted treatment for elderly patients. This targeted treatment is intraoperative radiotherapy. And here in this study, we included patients with a low recurrence risk, because here the specialty was to test intraoperative radiotherapy as a single treatment. So this is some kind of one-stop shop study, testing intraoperative therapy during surgery, directly after tumor resection, and combining intraoperative radiotherapy and then having a treatment in one step. And we included here patients with 70 years or older with small tumors less than 3.5 centimeters. We looked for patients without lymph node invasion or metastasis, and all of them gave their informed consent to participate in the study. This is a phase 2 study, so we did not have any randomization, but all of the patients fulfilling inclusion criteria and giving their informed consent went into this treatment. Additionally, this is a risk-adapted approach. So after having intraoperative therapy, we looked again at the risk factors in the final histopathology, which is only available after having surgery. And if risk factors were low, as we expected for low-risk patients, the treatment was over. And if any additional risk factors showed up that we did not expect before surgery, we added an additional whole breast radiotherapy, but then the IORT functioned as an anticipated boost, which is indicated when patients have a higher risk, as we have seen in TARGIT-BQR. So the results for this, in the end, 474 analyzed patients with a median follow-up of 3 years, where that we again saw really excellent outcome. The primary outcome was local recurrence, which we saw in only 4 cases in this nearly 500 patients. They appeared after 11, 33, 42, and 43 months. All of these patients received IORT only, but all of them had additional risk factors, but did refuse additional whole breast radiotherapy. So we might think that if they would have additional whole breast radiotherapy as the protocol stated, then maybe we would have a relapse rate of 0. But I think still this is a really good result. And with Kaplan-Meier estimates, we ended up with 1.5% of local relapse rate at 5 years, which is really good. And secondary outcome here in this analysis was overall survival. And we saw 20 deaths, 3 of them breast cancer related death and 17 non-breast cancer related death, which ended up with a Kaplan-Meier estimate of 91.4% after 5 years in this elderly patient cohort. I think these results show that IORT is really a feasible method and ends up with a really high control rate in elderly patients. As elderly patients also sometimes have comorbidities or also other preferences, for example, to having a fast treatment. This is really a nice option for especially these elderly patients to have a fast and safe treatment. So it also widens the portfolio of methods for patients. and also shows that additional radiotherapy is really a high effective method to reduce local recurrence rate and also to have a high overall survival in this elderly patient cohort.